14. Trileaflet valve prolapse. Trileaflet valve prolapse, also known as physiological valve prolapse, is a condition where the tricuspid valve does not close completely, leading to a backflow of blood from the right ventricle to the right atrium during ventricular contraction. 14. Trileaflet valve prolapse represents the mildest. Category: Cardiovascular. Category: Cardiovascular. Trileaflet valve prolapse, also known as physiological valve prolapse, is a condition where the tricuspid valve does not close completely, leading to a backflow of blood from the right ventricle to the right atrium during ventricular contraction. 14. Trileaflet valve prolapse represents the mildest degree of prolapse and usually does not require treatment. However, if the patient experiences symptoms such as chest pain, shortness of breath, fatigue, etc., it could indicate pathological valve prolapse, requiring timely medical intervention. 1. What is 14 trileaflet valve prolapse? 1. What is 14 trileaflet valve prolapse? Tricuspid valve prolapse is a heart valve disorder where the tricuspid valve, located between the right ventricle and right atrium, does not close completely, resulting in blood leakage back into the atrium during ventricular contraction. Tricuspid valve prolapse is classified into 4 grades based on severity. 1. What is 14 trileaflet valve prolapse? 14 trileaflet valve prolapse, the mildest degree of prolapse, often requiring no treatment. 24 trileaflet valve prolapse, mild prolapse, requiring monitoring and treatment if symptoms appear. 34 trileaflet valve prolapse, moderate prolapse, requiring treatment to manage symptoms. 1. What is 14 trileaflet valve prolapse? 44 trileaflet valve prolapse, severe prolapse, requiring aggressive treatment to prevent complications. 1. What is 14 trileaflet valve prolapse? 14 trileaflet valve prolapse is the least severe grade. In some cases, 14 trileaflet valve prolapse can be physiological, meaning the valve structure is normal but its function is impaired. However, if symptoms like fatigue, shortness of breath, chest pain, etc., are present, it could be pathological prolapse caused by other factors. 2 Causes of 14 trileaflet valve prolapse. Several factors can contribute to 14 trileaflet valve prolapse, including congenital. Some individuals are born with abnormalities or dysfunction in their tricuspid valve. 2 Causes of 14 trileaflet valve prolapse. Cardiovascular diseases. Cardiovascular diseases like cardiomyopathy, endocarditis, other valvular heart diseases, etc., can damage the tricuspid valve and cause prolapse. Aging. The tricuspid valve can deteriorate with age, leading to incomplete closure and prolapse. 2 Causes of 14 trileaflet valve prolapse. Hypertension. High blood pressure can exert excessive pressure on the tricuspid valve, leading to damage and prolapse. 2 Causes of 14 trileaflet valve prolapse. Pulmonary diseases. Pulmonary diseases like chronic obstructive pulmonary disease (COPD), interstitial lung disease, etc., can increase pulmonary artery pressure, causing tricuspid valve prolapse. 2 Causes of 14 trileaflet valve prolapse. Rheumatic fever. Rheumatic fever is an inflammatory disease that can damage heart valves, including the tricuspid valve. Medications. Certain medications, particularly those used for cancer treatment, can damage the tricuspid valve and lead to prolapse. 3 Symptoms of 14 trileaflet valve prolapse. 14 trileaflet valve prolapse often remains asymptomatic. However, if it progresses to a severe degree, the patient may experience symptoms such as fatigue. The right ventricle works harder to pump blood to the lungs, leading to fatigue. 3 Symptoms of 14 trileaflet valve prolapse. Shortness of breath. Blood pooling in the lungs causes shortness of breath. Chest pain. Increased workload on the heart and blood deficiency can cause chest pain. Leg swelling. Blood pooling in the legs can cause swelling. 3 Symptoms of 14 trileaflet valve prolapse. Rapid heartbeat. The heart works harder to compensate for blood backflow, resulting in a rapid heartbeat. Dizziness. Inadequate blood flow to the brain can cause dizziness. Fainting. Extremely low blood flow to the brain can lead to fainting. For diagnosing 14 trileaflet valve prolapse, a doctor can diagnose 14 trileaflet valve prolapse using the following methods. Auscultation: the doctor can hear a swishing sound of backflowing blood through the tricuspid valve using a stethoscope during auscultation. For diagnosing 14 trileaflet valve prolapse, echocardiogram. Echocardiography is an imaging technique that allows the doctor to visualize the tricuspid valve and assess the severity of prolapse. Electrocardiogram (ECG). ECG helps assess heart function and detect any abnormalities. For diagnosing 14 trileaflet valve prolapse, chest X-ray. Chest X-ray helps assess the size of the heart and lungs. Blood tests. Blood tests assess heart function and detect any abnormalities. 5. Treatment for 14 trileaflet valve prolapse. Treating 14 trileaflet valve prolapse depends on the severity of prolapse and the patient's symptoms. Mild 14 trileaflet valve prolapse usually does not require treatment. The doctor may recommend regular echocardiogram monitoring to track the valve's condition. 5. Treatment for 14 trileaflet valve prolapse. Severe 14 trileaflet valve prolapse. The doctor may prescribe medications to manage symptoms and prevent complications. These medications may include: diuretics help the body eliminate excess water, reducing leg swelling and shortness of breath. 5. Treatment for 14 trileaflet valve prolapse. Vasodilators help dilate blood vessels, reducing pressure on the heart. Anticoagulants prevent blood clots from forming in the heart. Surgery. Tricuspid valve replacement surgery may be necessary if severe prolapse is not effectively managed by medications. 5. Treatment for 14 trileaflet valve prolapse. Diuretics help the body eliminate excess water, reducing leg swelling and shortness of breath. Vasodilators help dilate blood vessels, reducing pressure on the heart. Anticoagulants prevent blood clots from forming in the heart. 6. Complications of 14 trileaflet valve prolapse. Untreated 14 trileaflet valve prolapse can lead to various complications, including heart failure. The heart works excessively to compensate for blood backflow, leading to heart failure. Pulmonary edema. Blood pooling in the lungs can cause pulmonary edema. 6. Complications of 14 trileaflet valve prolapse. Arrhythmias. The heart's increased workload can lead to fast or irregular heartbeats. Arrhythmias. Blood clots. Blood pooling in the heart can form blood clots, potentially blocking blood vessels. Stroke. Blood clots can travel to the brain and cause a stroke. 7. Preventing 14 trileaflet valve prolapse. While completely preventing 14 trileaflet valve prolapse is not possible, certain measures can reduce the risk. Blood pressure control. Maintaining normal blood pressure. Cholesterol control. Keeping cholesterol levels within the normal range. 7. Preventing 14 trileaflet valve prolapse. Diabetes management. Keeping blood sugar levels under control. No smoking. Smoking damages heart valves. Regular exercise. Regular exercise strengthens the cardiovascular system. Healthy diet. A healthy diet helps control blood pressure, cholesterol, and blood sugar. 7. Preventing 14 trileaflet valve prolapse. Regular checkups. Regular health checkups can detect early signs of 14 trileaflet valve prolapse and other cardiovascular diseases.